Welcome back to the Pharma Forum podcast. In this episode, I speak with Jesse Mendelsohn, Senior Vice President of Model N's Center of Excellence. We discuss the US election and its result, and multiple aspects of the drug pricing debate in America, speaking before President-elect Donald Trump confirmed his controversial nomination of Robert F. Kennedy Jr. as US Health and Human Services Secretary. As stands, Mendelsohn steps up to some what he terms loaded questions on the then current state of affairs in the US, suggesting that, and using history as a guide, there will be a layering of new laws under the Trump administration with, for example, a push for changes to the Inflation Reduction Act rather than repeal of it. And we also, of course, explored the potential impacts all round on pharma also. It's a timely conversation, so tune in, send in your comments if you have any, and as ever, thank you for listening. Welcome to the Pharma Forum podcast. This is web editor Nicole Raleigh, and today I have with me Jesse Mendelsohn, Senior Vice President of Model N's Center of Excellence. Model N optimizes revenue and ensures compliance for life sciences and high-tech innovators. Welcome, Jesse.
Thank you for having me.
So, the US election, or the result of the US election, whichever side you stand on, the presidential election has been reigniting the drug pricing debate. And today, pricing and compliance expert Jesse will discuss why, in his opinion, there is going to be a dramatic shift away from the traditional big pharma versus regulators narrative and explore the potential coming developments for America. To start with, though, Jesse, perhaps you could tell listeners a little about yourself and the drivers that led you to doing what you do today with Model N.
Sure, I appreciate the question. So I'm currently Senior Vice President at Model N, and we're a software company that were founded in 1999, and we automate revenue management for pharmaceutical and other life science manufacturers. And it's interesting, you ask how I came to do what I do. So I came from the IT side. I came from the technology side, but I fell in love with the business of pharmaceuticals and what it takes to get life-saving therapies to patients. So it's been a fascinating almost 2 decades at Model N, seeing the intersection between these two areas and even more so the impact that regulation has had over the entire spectrum of pharmaceutical delivery over the last 2 decades. It's been a very interesting journey.
Thank you, Jesse. So to our main theme, where would you like to kick off? I mean, in the week following the US election, we as a news outlet have been discussing concerns about the future of the Affordable Care Act, or ACA, which provides health insurance for more than 21 million Americans. Indeed, Trump has been talking about putting forward, quote, quote, concepts of a new plan for healthcare. And at the end of 2025, subsidies offered to people buying insurance in ACA marketplaces by the federal government, extended by the Inflation Reduction Act, or IRA, are set to expire. And if they are not extended, there are concerns that some people will be unable to afford cover. There are questions over whether Trump will repeal the IRA, deeply unpopular as it is with the pharma industry, due to controversial elements such as enabling Medicare to negotiate drug prices, but popular with much of the public for setting a $35 per month out-of-pocket cap on insulin products, for example. Then, as Pharmaceutical Technology reported, there's concern over Trump's likely appointment of former Democrat and anti-vaxxer Robert F. Kennedy Jr., aka RFK, within healthcare, the president-elect having suggested that RFK will be given the authority to carry out his plan to, and I quote, make America healthy again. So, Jesse, what are your thoughts here with all this? With the Trump administration due to commence in January and with Republicans in control of the Senate and potentially the House, what are the implications either way, firstly, for the public?
So it's a loaded question, and I appreciate the chance to answer it. So Historically, it's whether you're talking about healthcare, health insurance, or pharmaceutical products, or even just more broadly, laws. It's challenging for new administrations to fully repeal or just get rid of previous administration's law. That typically isn't how it works. Politicians may run on the fact that they dislike or don't appreciate a law that a previous administration had passed. But when they are elected and come into power, very rarely do they just repeal it. They typically make their mark by adding to it. And that is, there's no exception for that when it comes to pharmaceutical regulations and pharmaceutical products. For example, I remember a couple of years ago when the Inflation Reduction Act was first signed into law by President Biden, the CEO of my company reached out to me and said, "Oh, so Jesse, what do these laws replace? Like, what do manufacturers no longer have to do? What is this new system?" And the answer is, well, no, that's not how it works. They need to do all those things that they previously did, and now also this. So historically, new administrations make their mark by layering additional laws on top of the regulatory framework that is already there. So I think. If these are very uncertain times, but if you use history as your guide, I think there's a higher chance that the Trump administration will push for specific new laws that will perhaps change aspects of the IRA or the ACA versus just repeal, quote unquote, Obamacare or repeal the IRA, which I think will much be harder to do. I think the reason that that's hard to do is because, as you mentioned in the question, there are parts of these laws that people really, really like, even despite there are also be other areas that they're very, very unpopular. Remember with, quote unquote, Obamacare or the ACA, yes, to this date, there are parts of it such as taxpayer subsidies or the famous, personal mandate that were very and remain very controversial. But other parts of the ACA, like staying on your parents' insurance until you're age 26 or mandating insurance coverage for pre-existing conditions, were and remain very popular. In fact, the ACA passed in 2010. There's a generation of Americans now that are appalled when they hear that there was a time when insurance companies could reject you because you had a pre-existing condition. That was the ACA. So a full repeal of the ACA wasn't possible during the first Trump administration, and I think that's the history we should rely on. Moving forward, that same thing applies to the IRA. Yes, to your point in the question, there are things like Medicare negotiating and price capping, more and more lists of drugs that are very unpopular, both with the Republicans in Congress as well as to the pharmaceutical industry in general. But as you mentioned, the price cap on insulin, or the fact that senior citizens in the United States who are covered by Medicare are going to enjoy a $2,000 cap on total expenditure starting next year. These are very, very popular, and senior citizens are a large constituency. And it's very unlikely that a full repeal of the IRA will happen because it's going to get rid of these very good things along with the very bad things. So, again, if I dare use history as a guide, we're going to see a lot more layering new laws or nitpicking at pieces of the IRA versus just we're going to repeal the ACA and repeal the IRA and all that goes with that, because that perspective has been very unsuccessful in the past. Again, these are uncertain times, but if we use history as a guide, that's likely what I predict will happen.
Absolutely. I was actually going to reiterate uncertain times indeed, and a valid point with the ageing population and the popularity that might remain with a good chunk of the American people. So moving from that layering perspective, what about pharma? I mean, you spoke with Pharma Shots earlier in the year in a conversation around drug pricing reforms from the IRA following Model N's launch of its solution, Medicare Part D inflation rebate per unit. And in that discussion, you explored how rebates ensuing from the IRA guidelines were heavily affecting the revenues of biopharma companies. So how will things stand now, do you think? What are the potential implications for pharma? And possibly tell us more about Model N's Medicare Part D inflation rebate per unit solution.
Absolutely. It's a good question and something that pharma likes to bring up a lot in industry conferences. So, broadly speaking, in the pharmaceutical industry, we talk a lot about what we call the gross to net bubble, quote unquote. And I have to give Dr. Adam Fine and from his, the Drug Channel's blog credit for coming up with that term. We're simply there's a large difference between what manufacturers charge as the list price for a product in the United States versus what they end up enjoying with the net price that they get from that sale. And that delta, that bubble, that difference is paid out in numerous rebates to government agencies like the Veterans Administration and the Center for Medicare and Medicaid Services, but also to private entities like health systems, PBMs, and even individual hospitals or physician practices. And the number of these rebates from the IRA is just increasing, including these additional rebates associated with inflation penalties that are part of the IRA. Now, specifically to Medicare Part D and Part B inflation rebates, it's a concept that had already existed in other government programs. So for the Veterans Administration, for example, for selling drugs on the federal supply schedule, which is the list that the Veterans Administration buys off of, there was already a mechanism in the pricing math to cap the price increase that you could increase drugs at each year to roughly the rate of inflation. The same thing has already existed in Medicaid for quite some time, both for generic and branded drugs, where if you increase the price of your drug faster than the rate of inflation, you essentially owed a rebate back to the state Medicaid program, roughly equivalent to that non-allowable increase, the increased price of your drug higher than the rate of inflation. So I will say the Medicare Part D and B rebates weren't as shocking to manufacturers because this concept had already existed both for the Veterans Administration and also for Medicaid. But to be clear, these now add to that famous gross to net bubble. These are now additional rebates that manufacturers need to pay out after selling their drug. So there might be an impetus for manufacturers to make up this money on the commercial side. Yes, on Medicare we owe the difference in rebates to Medicare for the unallowable price increase over the rate of inflation, but for the commercial side, for private plans, we don't have the issue. So maybe we're going to raise our price there potentially enough so that we make that money back in other ways. Or it also might, limit manufacturers' ability to increase their prices because they don't want to trigger that inflationary rebate, which could cause financial difficulty for the manufacturer. So there's a lot going on here, and manufacturers are already starting to model and see what these inflationary rebates in Medicare have on their pricing strategy, their price increase strategy, and their commercial contracts. Now, specifically, we've released software to our customers, which will detect specific which drugs cross this inflationary threshold, and then calculate the rebate per unit associated with these drugs that they would then owe Medicare for units dispensed under Part B or Part D. So this will support the manufacturers, their accrual processes that they're already doing for this. And eventually, once we get some additional government clarity on how these rebates will be paid and to whom the check is sent, we will also support general processing for those rebates themselves.
Thank you, Jesse. Yes. So while we still wait for governmental clarity, let's extend beyond drug development in drug manufacturers to include in our discussion pharmacy benefit managers, or PBMs, those recently maligned middlemen in the pharma supply chain. What future for them, in your opinion?
So I'm glad that you said recently maligned, because that is actually true. It's very recent, but they are finally maligned. It's a good point. The previous Trump administration showed more awareness and sensitivity to the roles that PBMs play in increasing drug prices. Now, more recently, the Biden administration, more specifically in certain congressional hearings, Senator Sanders really seemed reticent to place the blame on higher drug prices on anything other than the pharmaceutical manufacturer. So historically, we already have some evidence that a second Trump administration will potentially revive analysis or at least investigation of PBMs and their role in increasing drug prices. There was even an attempt made during the previous Trump administration for Medicare Part D to force pharmacy benefit manufacturers to, rebate that they got from manufacturers to the actual patients who are getting the dispensed unit. So we might see some return to focus on PBMs and PBM reform in a new Trump administration. I also want to say, you said recently in the line, that is also true, as I mentioned. There's finally a growing awareness among the general public about the potentially toxic roles that PBMs can play in that they demand higher rebates, which is causing higher prices. There's been some exposés in very large, very popular American publications, including some of the biggest newspapers in the country, and front page news saying about what is the PBM, what does it do, and more specifically, could this be one of the major culprits for higher drug prices, which is a prevailing thought out there. So I think there's some maybe optimism that there might be some PBM reform, but again, these are uncertain times. It's hard to predict anything. I think it's very hard to tell. You could be certain that PBMs are already reacting to the potential that they might be, in regulators' scrutiny. They're acquiring and becoming more vertically integrated with other healthcare companies, and they're also spinning off various things. They're trying things like making their own private label products. They're trying things like rebranding themselves to more of a group purchasing organization than a benefits manager. So there's a lot of preemptive strikes from the PBMs to try to reorganize or defensively set themselves up from any scrutiny. And I think it's because there is a general anticipation that the Trump administration will be a bit more willing to take action on the PBM side versus just the tired and true old mantra of, big pharma, evil big pharma.
Mm. Yes, as you say, it's hard to predict anything just yet, and there are many reactions across the board. And we could possibly continue this conversation at length, Jesse, but for our listeners, how would you summarize what we've been discussing today? Is it a black and white either-or situation, or is the immediate future still one of many tones of grey?
I'd not be surprised if it's many tones of gray. Mm-hmm. The one that we be certain of is that it's going to be just more complicated. There are going to be additional rebates that are due, more reports, more filings, more audits, more scrutiny. And I think, as I mentioned at the beginning of our conversation, just more new things that don't replace the old. More new things that manufacturers are going to have to do to comply with the various regulations that, while still having to pay the same rebates, submit the same filings, calculate the same prices that they have in some cases for 20 or 30 years for the old. I think it's only to continue. And I think it's the reason why, it's so exciting being in my space, the intersection between the pharmaceuticals and technology. And it's why manufacturers are investing so much in technology like Model N has, because it's only getting more complicated. The scrutiny is only getting more complicated. The pricing pressure is only getting more complicated. And it's going to be, not more of the same in the Trump administration. More unpredictability is what I would say.
Thank you, Jesse. It's been a pleasure.
Thank you very much, Ellie. I enjoyed talking with you.